Welcome to the COVID-19 press briefing. With us today, Dr. Chang Shuk Kwan, Head of Communicable Disease Branch of Center for Health Protection, and Dr. Larry Lee, Chief Manager of the Hospital Authority. And Dr. Chang will talk about the latest case situation. Good afternoon. We have 471 PCR positive cases and 475 from RET tests. Altogether, 946 positive cases. The total number of positive cases in the fifth wave is 1.1 million and 8,353 people. And together, those from 747,808 from PCR tests. And out of 471 PCR tests, and 78 were confirmed by the Hospital Authority. 93 cases were tested by the CHP labs, and 300 of those tested by the private clinics. From the 253 cases, we performed some genome analytics. We haven't located any L452R cases. 250 of those are negative on L452R, and 3 are pending results or the viral load was too low. Of today's cases, including 11 imported cases, 9 of which tested PCR positive and 2 from RAT, and 8 of those were arrived from yesterday from 5 flights, and 4 took the QRA18, and 1 LD205, and 1 on 5J114, and another KF607, and SQ894, and 3 arrived Hong Kong earlier. And there were no new cases from the residential homes. And for those of a previous outbreak, we have new cases, 20 of the residents and 2 involving staff. From 15 residential homes for the elderly and 3 from the RCHDs. For the mortality case, the Hospital Authority reported 67 death cases with 28 positive report. Altogether, we have 8,797 mortalities, and for 59 cases from other sources, altogether 8,856, and it include 3,643 women and 5,213 male patients. And for the overall death rate is 0.74%. And there's not much difference on other indicators. That's the end of my report. We now invite Dr. Larry Lee on the HA situation. Good afternoon. Currently, the HA has 8,391 patients in different hospital, North Lantau Infection Control Center, and the AWE Treatment Center. Last night, 5 patients were in a critical condition, 3 were unvaccinated, 1 with 1 dose, 2 with 2 doses, and 5 in a serious condition, and 56 critical patients are in the ICU. As of today, midnight, in the past 24 hours, we have 36 positive patients passed away, 19 male, 17 female, aged between 59 to 97. Of the 37 cases, 12 of them are residential homes and 22 no vaccination records, and 2 had 2 doses, and 35 of those were 65 or above. And there's one younger death case I will elaborate in detail. 59-year-old female with no vaccination record. She had Takayasu's disease, and she had a blockage due to inflammation, and she had a stroke as well. And she was screened admitted at the Eastern Hospital Internal Medicine ward. And on the 6th of April, on the thoracic cavity scan that was suspected to have lung cancer. Upon admission screening, she reported positive CD value at around 15. Her treatment included prescribing Paxlovid and emergency chemotherapy, electrotherapy. She continued her treatment in the oncology ward. Her condition started deteriorating on the 12th of April, and her oxygen and she found to have had inflamed, and she finally passed away on the 14th of April. Due to a delay, and during the 27th of February to 13th of April, there were 31 deaths, 15 male and 16 female, aged between 62 to 103. And for the 62-year-old death case, she had one single dose, and a resident at the residential home. She had high blood pressure, dementia, and stroke. In early March, she came down with COVID-19, and she was admitted to the Yanchi Hospital on the 25th due to shortness of breath, and after x-ray she was found to have water in his lungs and also high white blood cells count. And on the same night at around 8 o'clock, she passed away. And for the past 24 hours, there are 1,811 admits and 2 classified as close contact. And for the staff, 21,871 confirmed, and 20,804 staff returned to their duties. That's the end of today's report. And we want to open the floor to questions, and please through the microphone, and please introduce the media organization you're representing. That lady. Cable news. For the QR818 with 4 passengers positive. Will this flight be suspended? With the start of the Easter break, and we notice there are more people on the streets, and there will be relaxing of the anti-epidemic measures very soon. And how do the CHP assess the risk? Any chance of a rebound? And for the B8.5, any imported cases? And for the transmission and the capabilities, can the CHP provide with more data? Of the 4 cases from QR818 have triggered the circuit breaker mechanism, and the flights will be suspended from 16th to 22nd of April. There's no point BA5 new cases for now. We'll find out the latest situation from the WHO research. With more people going out during the Easter break, this will entail certain risk, and I hope everyone to keep their mask on when going out and wear it properly while maintaining personal hygiene. Next. HK01. You mentioned there was a 59-year-old death case. That this case showing symptoms of lung cancer and found that she had pneumonia. Is she died of COVID? And the death cause analysis will be see that if these cases are really died of COVID. When will you look at death rate, and will you revise the 0.748% for the BA.5 strain? So long that you can't detect L452R, that means that this will be the BA.5 or BA.4 mutant strain. of a 59-year-old death case. So she had Takayashi syndrome, and she had problems with the thoracic cavity. And on top of her lungs, we suspect there was cancer. As the case condition deteriorated, we're not able to do further investigation. From the X-ray, we suspect that she had pneumonia. However, there could be different possibilities. Either it could caused by swallowing or caused by COVID. So whether this case is related to COVID, at this moment I can't answer you yet.
Regarding the death rate, we are still checking the data. Well, we have already published some preliminary data. Detailed data will be published once available later. Concerning BA.5, apart from L452R, there are other tests, F486V, and other characteristics. Well, our screening would cover L452R first, because there was some Delta variant, and that would mean the L452R was positive. But for F486V, there is negative. But if we find some sample with 452R positive, then will be further analysis to decide whether this is Delta or is more likely to be L452R positive Omicron. So it doesn't mean that once it's L452R positive, it must be Delta. BA4 and BA5 all have L452R. So if it's an L452R negative, then it's not BA4 or BA5. Now TV. Today, the number has dropped to under 1,000. It's a three-digit figure. Do you think this is still a high level of infection? And if they're not, then when are we going to expect a lower level of infection? We have 1.18 million infected cases. How about herd immunity in Hong Kong? People are coming out during the Easter holidays. Do you see a chance of a rebound just like previous outbreaks? But now we have more people who have come down with COVID. So what do you think? Well, that depends on where to which you make the comparisons. Of course, it's lower than in during the peak of the fifth wave, but 1,000 cases is still high compared with the previous waves. But of course, the risk is relatively lower now. The University of Hong Kong has been looking at the real-time reproduction number is a 0.4, something like 0.4. Some factors will affect the reproduction rate concerning the flow of people and all the transmission among crowds. If the R rate is lower than 1, then it means that the number is not increasing. If it is bigger than 1, that means the number will be increasing. As for immunity, under the Hong Kong Youth mathematical model, we have already got 4 or 5 million people who have been infected. So the risk is not as high as previously. But maybe we have 2 to 3 million people who haven't been infected. Of course, they may have been vaccinated, but vaccination is not a total protection against infection. So everyone should wear their mask. There's a chance for a rebound. If we have more gatherings, while people stayed at home previously, infection would be prevented, and now people go out, and Omicron variant is very highly transmissible. Even if mask during earlier investigations, we understood that there's still a chance of transmission even with your mask on. So if you go to high-risk areas, or if you are worried, you have to do more tests. Doctors, I'm from TVP. It was said that at the end of April, all the relevant residents of residential homes will be vaccinated. Now it's 90% vaccinated. Do you, or we want to achieve an objective of 90%? Will you be able to achieve this target by the end of this month? And also 190,000 people have already received 3 jabs. Are they eligible to get the 4th jab? And there was a case of a male coming from South Africa with BA.5. Would there be new variants coming to Hong Kong? Is there a high risk of? Do we need to extend the quarantine period for new arrivals? According to the Civil Service Bureau, the press release issued by the Civil Service Bureau, in respect of residential care homes for the elderly, we have increased the vaccination rate from 55% to 70% on the 17th of April, and 81% for the for those who have received a second or third jab is 42%. And many of these are recovered patients. They have not yet received further jabs, so that they will wait until that time is up. For BA.5, well, the case was uncovered in a quarantine hotel, and the patient was sent to a community isolation facility. We'll continue to monitor the situation. Next, any further questions? Yes, that. I'm from Ming Pao. We are now in the 3-digit territory in terms of confirmed cases. Some experts have said that we may be able to go for the community-wide general testing when the figure is in 3 digits. Is it the right time to do it? As for the 62-year-old patient, the death case, did the person was the person admitted on the 5th of March and he died on the same day? If so, why do you make the announcement today? Only today? Well, if we are going to have a general testing in the whole community, that a lot of planning and preparation will be required. If we have got details, there will be announcements in good time. For the case involving a 62-year-old patient, he was admitted on the 25th of March to Yan Chai Hospital A&E department. He was admitted at about 9 o'clock in the morning, and he passed away at about 8 o'clock in the evening. So we would update the information as soon as the case is confirmed. But there were many cases previously, and therefore we were unable to make the announcement before today. All right, if there's no other question, then that's the end of the press briefing. Thank you.